There are very few COVID-19 access restrictions left at the Rotunda Hospital. The only restrictions that are currently in place are to reduce overcrowding in some very particular areas of the hospital that have been challenging in this regard. For example, in the general outpatients area, we would commonly have 60 or 70 women in that waiting area at one time. So making that 120 or 140 adults in an area that doesn't have ventilation is not possible. Therefore, for most outpatient visits, the patient has to attend on her own. However, as always, the Rotunda makes exceptional arrangements for parents where there's going to be a complex consultation or likely to be difficult or complicated news to deal with. Additionally, in some of our prenatal wards, where there's 6 or 10 beds in one room, it's possible that overcrowding can also be a significant challenge there. Therefore, for some mothers admitted for induction of labour, at the very start of the induction process, it's possible that they may have to be unaccompanied. However, as soon as any mother expresses any discomfort or any need for their support person to be present, we do our very best to get partners in immediately. Other than that, there are virtually no restrictions left at the Rotunda, and our access is almost identical to what it was like before the COVID-19 pandemic. For example, partners can now visit any time between 8 a.m. and 8 p.m., which was the same as it was before the COVID-19 restrictions. In addition, for all deliveries, partners are present. Indeed, when bad news has been delivered, such as with a miscarriage, partners will obviously be present. And in addition, for early pregnancy scans and for the anomaly scan, the so-called big scan, partners are present. So really, there are very few restrictions, if any, left at the Rotunda, with the few that are there designed purely to protect patients in the very select overcrowded zones of the hospital.
And that's a really good question. You would think it'd be obvious that vaccination would sort everything out. And vaccination is amazing, and the science behind vaccination is incredible. However, the way the COVID vaccination works is that you are less likely to catch COVID, but it doesn't guarantee you won't catch it. And should you catch COVID, you can still transmit it to others. So COVID is still in circulation and we're still at risk. And that's why in the hospital here, even though the large majority of our staff are doubly vaccinated, we are still keeping all the safety measures, wearing surgical masks, practicing strict hand hygiene and maintaining social distance at all times.
We're often asked that if staff are vaccinated, or if partners are vaccinated, or if patients themselves are vaccinated, or indeed if we could test partners and patients, would that not be a better way to maximise the safety of patients at the Rotunda? Safety protocols at the Rotunda are designed to protect patients who are vulnerable, that is, patients who are not vaccinated. They're primarily designed to protect the 40 to 50% of mothers who are still unvaccinated and therefore vulnerable to COVID-19 infection. Since the advent of the Delta variant, we have been struck by how many pregnant women who get COVID-19 become seriously ill and indeed suffer the tragedy of a stillbirth. That is the group of patients that we are primarily tasked to protect.
And I think it's very understandable for women to ask questions around getting vaccination. I think when a woman is pregnant, she's so careful about everything that you eat, drink, coffee, all that stuff. What we do know about the COVID vaccination is that in the amount of women that have had the vaccination, both in the US and here, there's been no adverse outcomes reported. It's been seen to be completely safe. And actually the risk to pregnant women is far more from COVID. The risk of severe disease and getting very sick and having a premature baby is far more prevalent than any risk from a vaccination. So we would really encourage women who are pregnant to get vaccinated, get it as soon as you can in pregnancy so that you're fully vaccinated by your 3rd trimester. Yes, so hopefully if all is straightforward, you'll be at home for a lot of your labour. But if you do have to be admitted for a period of time to our prenatal ward, your partner is welcome to stay with you, and the visiting hours are 8 a.m. to 8 p.m. However, we would encourage partners to take time out to get some fresh air, a bite to eat, or a short walk, because once you go to labour ward, it gets very intense.